Hi, my name is Natalia Hall. I am a second semester nursing student. Today is November the 30th, 2017, and the time is 14:26. Today I will be performing a physical examination. At this point, I have come in the room, I've provided hand care, and now I will be greeting my patient. Hello, how you doing?
Hi.
My name is Natalia.
Mm-hmm.
Okay, so today I'm coming in because we're going to be doing a physical examination.
Yeah.
It'll be a full body head to toe examination,
Sure.
okay?
Mm-hmm.
At any time, if you have any questions, please feel free to stop me, okay?
Okay, sure.
So before we start, I'd like to get your name and your date of birth. I'm going to look at your armband.
It's ABA41685.
Okay. And then, are you aware of your location today?
Yeah, I'm in the Lincoln University Hospital.
Okay. And then, can you tell me what is the name of our current president?
Trump?
Yes, that is correct. So, your level of consciousness, you are aware to the time and to the place. So, to begin, we've already, before you came in, we've got your weight and your height. So, we had that recorded.
Okay.
So, at this point, I'd like to start off with getting a set of vital signs, okay?
Sure.
Okay. So, to start off, I'll get your temperature. All right, and it's 97.8, so that's a good temperature. And then I will get your blood pressure. And at this point, my patient, I would have as close to skin contact as I could. Would not have her on with the jacket. So I'll get your blood pressure. All right. And you're about 118/76. Is that pretty normal for you?
Yeah, it sounds about the same.
Okay.
Like I had the last few years.
Alrighty. So at this point, I'm just gonna watch you breathe a little bit. I'm gonna get your respirations. Okay. And you're about at a 16. And then I'm gonna get your pulse. Alright, are you a little nervous today?
Yeah.
Okay, your pulse is about a 90, which is still within normal range, so that is fine. And then I want to ask, are you having any pain today?
No.
No pain? Okay. So to begin, I'm gonna do some sterile hygiene, cleaning my hands, and I'm just gonna get some gloves on. Okay.
Okay.
All right, so I just want to start at your head. So I'm just going to be filling in your scalp, and your hair is evenly distributed, and I'm not feeling any lumps. Are you having any tenderness?
No.
All right.
No.
Feeling your cranium?
It's just my hair is itchy.
Your hair is
It's
itchy?
My scalp.
Is it? You think it's dry?
No, I think I have lice.
You think you have lice?
No, but
Well, I don't see any lice.
okay.
Yeah, so that's kind of why we do the hair exam as well, to see if you have any lice. So I'm going to go ahead and remove my gloves. Okay, now at this point, I'm going to feel your temporal arteries. And they're both present. At this point, I would like you to open and close your jaw. Okay, and close it. Any tenderness there? Okay. And that was at your mandibular joint, temporomandibular joint. So now I'm going to feel your sinuses. And you tell me if you feel any pressure or any tenderness. You do feel pressure and tenderness? All right. Have you been ever told that you had any sinuses?
No.
Okay. So then I'm feeling your frontal. Okay. And so then from there, I want to look at your eyes. And I'm going to look at the external of your eye. I'm not seeing any discharge or drainage. Your eyelashes look like they're not curving in or out. No signs of a sty or any inflammation. At this time, can I have you pull your eyelids down, looking at your conjunctiva? Okay, thank you. Now at this point, I would like to do a eye examination. So it'll be a few things that we'll do with the eye. So before we do that, I want to have you close your eyes for me. Smile. Now, keep your eyes closed. Smile for me. And then open your eyes. Okay. Thank you. So at this point, first I would like to do the accommodation of your eyes. So what I'm going to do is I'm going to put my hand behind you, and then when you see it, you let me know when you can see it, okay? So if you can just look straight ahead, okay? Okay. Okay.
Yes.
Okay.
Yes.
Alrighty. And then now I just want to look at your pupils, so if you can just look straight ahead for me. Alright, and your eyes, that one did constrict to the light. Alright, so pupils are equal and reactive accommodation. And then, well, while I still have my light pen, what I'm going to do is going to have you follow my pen. It's called the 6 cardinal gaze of signs of gaze. So if you can just follow, I'm going to go forward to you, and you just follow it with your eyes. Alright, and do not move your head. Alright, and then your pupils, they weren't sluggish or anything, so that is a good sign. Now this is your visual acuity. Do you wear any glasses or contacts?
No, I don't.
Okay, so I'm going to hold this about 14 inches away from your face. Okay, so it's about there. So I'm going to have you hold it, and then you just read, cover one eye, and then you read the lowest level that you can read for me.
426,739.
All right, and then put your hands over your other eye, trying to put a lot of pressure on it.
426,739.
All right. So you have 20/20 vision according to the Snellen chart. Okay. So now I'm gonna have you do your ears. Okay. And then once we do your ears, I'm going to have you probably sit up on the side of the bed for me, okay?
Okay.
So just looking at your external ear, okay? Is there any tenderness in that ear?
I don't.
Any tenderness? Okay. And what about this one?
No tenderness.
All right. So I'm going to look in both of your ears, okay? Do you have any questions so far?
No.
All right. Okay, well, we will pretend that was able to go on there correctly. So pulling your ear up and back, and looking at your eardrum and then your canal, and it's intact, and I don't see any redness. And then I'm going to come over to this side and do the same for this ear. Again, you said no tenderness?
No tenderness.
Okay. And its eardrum is intact, and I don't see any redness. Okay. Okay. So now at this time I want to look, before you get up, I'm going to look at your mouth. Looking at your lips. Can you open your mouth for me? Looking at your buccal mucosa. Okay. Looking at your teeth and gums. Okay. Can you go like this for me? Yeah. Alrighty. And then your tongue. And I see, okay, your tonsils. Alright, and then looking at your hard and soft palate. Okay, and it's patent and everything. Alrighty. At this point, let's see. I'm going to have you sit here, and I'm going to do what we call the, I'm going to do a whisper test, and then I'm going to use this tool to do a Ryan and Weber test. So we'll start with the whisper test, okay? I'm just going to come stand behind you. I'm going to whisper 3 things about 10 inches from you, and then you repeat what I say, okay?
Okay. 738.
All right. And then on the next ear.
2T6.
Yes. Okay. And then on the next thing I'm going to do is I'm going to hit this against my hand, then I'm going to place it at the top of your head about center, and then I want to know, you let me know that you hear the, when you start hearing the vibration, okay?
Okay.
All right.
Yeah, I hear it in both ears.
Okay.
Yeah.
So it's equally?
Equal in both ears.
All right. And then, so we still got a little bit more time. So the next thing is going to be the Ryan-Weber test, okay?
Mm-hmm.
So at this time, I'm going to put it here on this bone back behind your ear. It'll be there. And then once you stop feeling the vibration, I want you to let me know so I can put it towards your ear, okay?
Okay, sure.
All right.
Stop. I hear it.
All right.
Mm-hmm.
And then I'm going to do the next side.
Stop. Stop.
All
I'll
right.
still hear it.
You still hear it?
Yeah.
Okay. That's good. Okay, so now that we've done that, I'm going to go to your neck. So right now I'm just looking for any pulsations. Okay. And then I'm going to feel your pulses one at a time. And they are present. Okay. And then I just want to feel for any lumps or tenderness. Can you tell me if you feel any tenderness? Okay. Now again, I'm going to step behind you. Now with that whisper test, what I wanted to do, I needed you to cover one ear at a time, okay? So we're going to just repeat that. So if you can stick your finger in your left ear and not too deep, okay? I'm going to repeat some more letters and words, okay?
Okay.
All right.
Apple, A, I don't know. Maybe something wrong with my ears, for real. Apple 8C.
Yes. All right. Now do the next ear.
There, DJ.
Yes, that's correct. All right. Now while I'm standing behind you, I'm just going to feel for your trachea. All right. And it's midline. And then I'm going to have you swallow for me. All right. And that's checking your thyroid.
Okay.
All right. Okay. Now nextly, done your neck. So then we're going to move to your arms. You're going to do your skin, okay?
Mm-hmm.
And then with your skin, it is of your color, the temperature, it's warm. Are you hot?
No.
No? Okay. And then your skin, it's the moisture is even, and it's, I don't want to say that it's dry, but it is dry, but it's not scaly.
Mm-hmm.
So that's good. I don't see any lesions or abrasions or anything.
Mm-hmm.
And then down at your hand, I want to do your cap refill.
Mm-hmm.
All right, and it's less than 3 seconds. So that means that your blood flow is good. Okay, and then from that point, I want to just do some range of motions with your arms.
Mm-hmm.
So if I can have you put your arms up, all right, and then put them back as far as you can. Oh, you're pretty flexible there. Okay, and then also if you can just take your wrist like you're riding a bike. All right, and then can you open and close your hands? No, like this? Yeah. All right, and then spread your fingers apart and then bring them close together. Okay, that's good. Now, I want you to, pull up for me and then try to push down. Okay, and then same thing with your elbows. I want you to pull me towards you. All right, push me away. Okay, that's good. And then for your neck, we need to do range of motions on your neck.
Mm-hmm.
So if you could put your ear to your head to your ear, to the other side, look down. All right, look up to the ceiling. Okay, and then look side to side. Okay, so we've covered that. So now I want to look at your back. So we'll go to your back area. Let me get my stethoscope. Okay. So with your shirt off, I will be looking at your skin, looking at the symmetry of your back. and feeling for any lumps or tenderness. Are you noticing anything?
I don't feel any tenderness.
Okay. And then what I want to do now is looking for tactile fremitus. So I'm going to put the palms of my hand on your back, and when I do that in 4 places down, I'm going to repeat the words 99, okay?
Okay.
99?
99, 99, 99, 99.
All right. And so at this point, now I'm going to percuss in 8 different spots on your back, okay?
Okay.
I'm going to be tapping my finger. And then 1 more spot below. All right. And then now I'm going to listen to you in those same spots. First, I want to have you take some deep breaths for me. And then 2 more spots down below. Okay. Now I'm going to move to your anterior chest part, and so then we'll just do the same thing, okay? So first I'm just going to inspect, looking at your chest, watching you breathe, noticing your rate and your rhythm and the effort of breathing, and it doesn't seem like you're having a problem breathing. Your rate is still at about a 16, and your rhythm is within normal. Again, I'm not noticing any effort to breathe. Now I just want to do some palpations in your chest, and for any thrills. I'm not feeling any vibrations or anything in your chest. Okay. And then now I want to listen to you. Okay, and this will be 5 points. And then right at your 5th intercostal space. And then I'll have you lean forward for me. And stay leaning forward. All right, if you could lay on your side for me. All right, and I just want to feel that area as well. All right, and then I'll have you sit back up. Let's see. So I've done your chest area. Now at this point, let's go to your abdomen. So if you can just lay back down for me.
Okay.
Are you cold?
No, it's good.
Okay. So with your abdomen, I'm looking, it's not distended or anything. It's symmetrical. Oh, you got a nice tattoo there. Okay, and then looking above your umbilicus, I don't see any pulsations. And then looking at your umbilicus, it is, normal. It's not sticking out. And then at this point, I want to listen to it for your bowel sounds in all 4 quadrants. All right, and they're not either hyper or hypoactive. They are present though, which is good. And so now I just want to do some light and some deep palpations, okay? So. All right, and then like I did on your back, I want to do the same thing on your stomach, okay? And then at that point, we can go ahead and pull your shirt down. And now we're going to move to your lower extremities. So let me get some stuff that I need. This is all I need. So while you're still here, I'm going to go ahead and get do your reflexes on your elbow.
Okay.
So I'll find that spot. And then, all right. All right, and I'm looking for reflexes in your hand. I did see your fingers move, so that is good. Now, looking at your lower extremities, just looking at your legs and your skin, not noticing any lesions or anything. I'm going to feel your pulses at your popliteal. And they are both present.
Do you want me to take off my socks?
If you like, if not, I mean, you don't have to. Okay. And then I'm going to just feel for any edema below your tibia area. Or in your tibia, and I don't feel anything. And there's no edema noted. And then feeling your posterior tibia pulses. And they're both present. All right, and then your dorsalis pedis. And they're both present. And then I want to have you push my feet like a gas pedal. All right, and then pull them towards you. All right, and then let me get my handy dandy tool again. Checking your reflexes. The plantar region. Coming up, making a J. All right, that's what I'm looking for. Not looking for any spreading of the toes. Okay. And we can get your socks back on.
I got it. I got it.
Oh, it's okay. All right, and then I'll have you turn to the side of the bed for me. Now at this point, I'm going to do some deep tender reflexes, but I also want to do checking some range of motion. So can you pull up towards my hands? All right, and then can you try to kick your feet out? All right, and then can you pull them back? All right, and then while I'm here, I want to check your reflexes as well. But before we do that, can you take this leg and cross it over? All right, and then do the same at the X. Okay, and then go, yep, there you go. All right, and then I'm going to find your patella. I'm going to go right in between it. All right. All right, and then looking for reflexes there. And then can you take your ankles and turn them inward and then turn them outward? Okay. All right, and then up and down, which we've done that while you were laying on the bed. Okay, let me see. After we do that, let me do your reflexes on your Achilles as well. Good job. Now I'm going to have you stand up for me. Now I didn't really get to see your range of motion in your arms, so if you can just take your arms back for me once more, okay? And then bring them up, and then bring them outward, and then bring them across you like you're hugging yourself. Okay, that's good. Now while you're standing as well, we're going to do range of motion for your back and your spine. So I have you lean to one side, lean to the other, lean back, and then lean forward. And then as you're leaning forward, go ahead and touch your toes. And I'm going to be looking at your spine. And I'm looking for any S shape, like for scoliosis in your spine is symmetrical. I'll go all the way down to your sacral region. And again, any tenderness or pain? Nope.
No.
Okay. Go ahead and stand up for me. Okay, now if I can have you walk to that gray square, just normal walk. I want to look at your gait. All right, stop and turn around. Now walk with one foot in front of the other. Oh, you have a model walk. That's nice. Used to be a model?
No.
Oh. All right, and then I just need you to stand here for me. And I want to see if you can hold your balance, close your eyes, and we'll do this for 30 seconds. All right, and everything's fine there. And then now I just need you to twist for me as well. All right. Oh, you got a pop there. That's good. All right, you can have a seat. Oh, before you have a seat too as well, I want to have you kick out and then kick back. Be careful. All right, and then you might want to come up a little bit, or I can get out your way. And then you can kick your leg to the side and bring it in. And then do the same thing for the other one. And then back and forth. And then can you kick across like that? All right, and then do your other. All right, that's good. All right, now you can have a seat for me. And I'm just going to go over my equipment and make sure that I have everything. Let me see. Straighten your bed up. Okay. Oh, we got to do the coordination. I almost forgot about that one. So then for the coordination, I'm going to put my hand here. You're going to go finger to nose. So touch your nose and then touch my hand. All right. And then can you do this for me? All right. Do you have any questions? No questions? Oh, I need to do your skin turgor as well. All right. And then I need to do a test where I'm going to do for your neurology. Okay. Now, you can look on this one, but this is hard and this is soft.
Okay.
All right. So we'll do it on your face, your arms, your hands, your legs, and then on your feet, okay?
Okay.
All right. And then you tell me left or right side.
Okay. Soft left. Sharp left. Right. Sharp left. Sharp right. Soft right hand. Soft left hand. Sharp left leg. Sharp left leg. Soft right foot. Soft left foot.
All right. All right. So do you have any questions?
No.
No questions? Mm-hmm. All right. Well, I want to schedule a follow-up visit. The physician will, so I'll come back in with those orders. Mm-hmm. And I just want to thank you for your time. Okay. And if you have any questions, feel free to call back up to the clinic, okay?
All right.
All right. Thank you.